I'm Jarvis Odgers, physical therapist and clinic director here at Rebound Physical Therapy. Rebound is an outpatient physical therapy clinic dedicated to helping people get back to the lifestyle and activities that they know and enjoy. Today, I'm going to talk to you about back pain. Back pain is a huge issue in America. By some estimates, Americans spend over $130 billion with a B, dollars annually on neck and back pain. And that is simply medical cost. So that is insurance, co-pays, deductibles. That is not including lost income due to missed work. And probably even more importantly, it is not including loss of quality of life, the inability to live life to its fullest. And that's something you really cannot put a price tag on. So today, we're going to talk about a couple of common diagnoses or causes of back pain, what they mean, and what you can do to improve your symptoms and relieve your pain. So first, we'll start talking about a bulging or herniated disc. Sometimes you'll hear people call it a slipped disc. I slipped the disc in my back. So basically the disc are the spacers and the shock absorbers in our spine. So if you can kind of imagine your spine here, the space between my hands would be where your disc is. It gives us space and acts as a cushion. So a herniated or a slipped disc would mean that disc has started to slide out of its normal position, which can be problematic. It can start to put pressure on a nerve and give us either pain in the back or what we call radicular symptoms, but pain that runs down the leg. Now, the interesting thing is research would tell us that if you take MRIs of 100 people, about 50 of them are going to have a bulging or herniated disc that don't have any symptoms at all. So it's one of those that just because you have a herniated disc doesn't mean that you directly have to have symptoms. And a lot of times it's one of those that if you can work on strength, if you can work on mobility, you can go on living a active and full life with a herniated or bulging disc. Another commonly heard term is either degenerative disc disease or stenosis. And there's some caveats that are a little bit different, but for our purpose here, we'll kind of lump them in together. So again, that disc is our spacer, it's our shock absorber. Over time or after an injury, a lot of times that disc can start to deteriorate. It can start to compress in there to where we don't have as much space between those vertebrae. They become closer together, which again leaves us less margin of error for those nerves and some of the other structures in our back. I think every single week I'm treating somebody that has a degenerative disc disease or a stenosis diagnosis. Our job as physical therapists is to really figure out what I'd like to call the cause of the cause. We know you have this, but what else is playing into that diagnosis? So for stenosis, for example, they have less space in their back. Their margin of error is smaller. But typically they will say, I only get pain once I'm walking or standing for fill in the blank, 5 minutes, 10 minutes, a half an hour. So that tells me that they have enough space in that back, but something changes. It's usually a muscle imbalance or lack of mobility through their hips that then feeds off of that degenerative disc disease. And that's kind of our job as physical therapists, is to be able to really break down how they move. We're the movement experts. We can look at how they move. We can assess how joints move, how muscles move, what a strength or muscle deficit is. And then when we address those symptoms, you can usually make a ton of improvement in your symptoms. So if you're out there, if you're suffering from back pain, if you're limited with what you can do because of either back pain or pain down your legs, it's not something you need to tough it out or deal with, or I've always had this. It is something that is manageable, it's treatable. You can both improve your symptoms and your quality of life. So do something about it. Give us a call. We'd love to talk to you about your symptoms. give us a call today and we'll set you up for a free screening here at Rebound.